सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामया सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्. May all be happy, may all be peaceful, may all live, reside in the company of the highest divine within themselves. Okay, so today we'll focus on the carpal tunnel syndrome. Many people have requested, so I thought of giving some yoga tips for that issue. How do you know you have carpal tunnel syndrome? First, many people get diagnosed by a doctor, but if you have some tingling sensation in the thumb area, or that can radiate up to two middle fingers, to one or two, this middle finger and the index finger. Sometimes it can go up to the ring finger as well, but not, it doesn't go to the pinky toe side. These three fingers, but mainly the thumb, if you have any sensation, tingling sensation, then it can be a carpal tunnel syndrome. Not necessarily, but yes, it can be. So to go further, if you tap this area, this area, this area which is sort of foundation of the thumb, which hold the thumb, this is technically known as thenar eminence. So if you tap this, and if you have numbing sensation, tingling sensation, some sort of nerve kind of pain, like you put some needle and you have that nerve sensation, if you have that kind of sensation, then chances are it is inflamed. And if this thenar eminence is inflamed, then it can press this nerve, which is a median nerve that passes through this area. And if it passes through this area, that passage is blocked, then it can cause that carpal tunnel syndrome. Yeah, so this is another test. The third test is then if you come in Namaskar Mudra, in yoga we do this a lot, and then press it down. If it hurts, then it can be. Yeah, so you come here, and if you keep going down, keep the heels of the hand together. Can you see? So heel should split out like this. Keep them together. Press the palms against each other, go down. If it hurts, maybe it's to some, if you have severe carpal tunnel syndrome, even this much should hurt. But if it hurt, for instance, here, then it shows that it's growing, progressing slowly. The other one is you grab the hand like this. So Namaskar Mudra, but just reverse the hand. So the heel of the hand facing toward the roof, the fingers facing the floor. And then come down, and it should hurt too. Yeah, it should hurt in this area, in thenar eminence. This is another test. So tapping and these two tests, and if you have, then chances are you can have carpal tunnel syndrome. It can have many reasons, because it happened because the median nerve is pressed. It can be pressed here in this area, or it can be pressed in the elbow. It can be pressed in this, in this shoulder area. There is a pectoral minor muscle here, pec minor. It can happen in this brachial plexus, and it can happen in the neck as well. So once you want to heal this issue, you have to work on the entire track which median nerve passes through. And if you open up all the passage, the current in the median nerve will go smoothly, and there won't be any pain. Yeah, so the pain happens because the current can't flow. For instance, if the current flows at the median nerve is about 100 miles per hour, but because of obstruction, it happening only 20 miles per hour. So nerve become very less efficient. 80% of the efficiency is not used. So in that case, it will hurt. You will have that. It will send some inflammatory signal to the brain that do something about it. Yeah, so all you have to do is to open up the passages, and then you will be healed. So when they do surgery, which is in most cases unnecessary, that's what they do. They surgically remove that part, so path is opened, and then the current can flow. So, but you can do on your own too. So if you open up all those structures, then you can do. So in the next stage, I will tell you what stretches, what yoga moves you can use to heal yourself if you have carpal tunnel syndrome. Just stay tuned. Okay, so now we'll come to the treatment part. How to heal it? First is Namaskar Mudra, the same. Press the hands against each other. Yeah. And press the hands, the thumb towards the chest, on the chest. So this is in yoga, we call it Namaskar Mudra. And keep the shoulder relaxed. So don't shrug the shoulder like this. Shoulder relax and in this position. And then try to bring this down slowly. And if it hurts here, then just stop there. Maybe come up. So you just knock the door of your threshold and stay inside your threshold. Don't cross it. And then slowly your body will open up, and then you can go deeper and deeper and deeper and deeper. Yeah. So this moment, if there is any restriction, just open it. You're pressing the hand against each other. Can you see? So don't move the hand out. Keep the hand in this position. Yeah. In the second stage, I'll come to the side. So you do this hand and then bring this, open this palm. So you're coming down and can you see? I'm opening a palm like this. So I'm pressing my thumb and fingers like this. Good. So you come down, open the hand. Come, open, come, open. This is the second thing you can do. You can do with me. So do it about 15 times, maybe 20. And slow and controlled. Yeah. And third, you come in this Namaskar Mudra and then turn the hand around. Yeah. And then do this. So Namaskar Mudra, turn around and then open up like this. And then back to this. And during this process, very important, don't shrug the shoulder like this. Keep the shoulder down. Scapula, relax. So press them down against each other, your palms, you're pressing against each other. And then 3, 2, 1, and relax. So slow and control. Again, 10 to 15 times. So this is the third thing you can do. Now for the next one, you need something like this. Yeah. A rod, or maybe in Indian home you have belan that can do. So something like that. Any stick will do. So move it in this position. Can you see? I'm moving the wrist. Keep the shoulder down. So don't shrug the shoulder like this. Shoulder down and relax. And you're moving the wrist, the hand up. My palms are facing the front of the wall. This position you want to do. Do this about 1 minute, maybe 2. If it hurt, then you do it gently like this, and then slowly you can go more aggressive. More aggressive means you lift the hand up like this. Gentle means you keep the hand down. Yep. So slowly build the strength. So it will build strength in the extensors of the forearm. Yeah, most people have these weaker extensors. Good. And after this, what you do, you bring it down like this. So now we're stretching those extensors. Yeah, and then see if we can do in this direction. Can you see? So in the first one, we're doing this. We're pulling it up, pulling it, and then now pulling it down. Yeah. During whole process, no shrugging like this. Shoulder down and relax. Again, 1 minute. And build it up to 2 minutes. What it will do, it will strengthen this structure here. As I said, the nerve passes through in this area. So and the third one is this. This is sort of ulnar deviation position, and then move. So far our hands are this position. Now hands are on the side. And now if you can do the same. Yeah. So the first two movement was this. Now movement is this to the side. First was this movement, now movement is this. Yep. So do it again for 1 minute, maybe 2. Okay, the next thing I will tell you about this shoulder. So what you do is you place the hand like this. So my palms, my fingers facing the floor, yeah, keeping the shoulder down, and like I'm pushing the wall away, pushing the wall away. At the same time, I'm bringing the right ear toward the right shoulder. So this is my left arm, and I'm bringing the opposite ear down. Yeah, keep the shoulder relaxed. Again, hold, minimum 30 seconds, maybe a minute. See my hand position. If that hurt, maybe you can bring it slightly up. Yeah. So more the hand goes vertical, perpendicular to the floor, harder it becomes. More it becomes, the hand becomes parallel, easier it becomes. You can choose the intensity according to your level. And then do other side. So first raise the arm, no shrugging in the shoulders, with palm like you're pushing the wall away, fingers down. At the same time, drop left ear on top of left shoulder, opposite. So this is a very, very good stretch. It's a sort of nerve flossing you're doing. So the nerve, which is a median nerve is pressed in the thinner eminence. That's why this carpal tunnel syndrome happens. So it stretches the entire tract the median nerve passes through, from the neck down to this brachial plexus, to the shoulder, to this pec minor area, and going down all the way through elbow to the wrist. So the entire tract will be stretched. So if any obstruction anywhere, this stretch will help. See the position of the hand, 30 seconds, preferably a minute. 3, 2, 1, and relax. The next thing you can do is place the hands like this, one hand on the top of other. This dorsal part of the hand is facing the roof. Place it down and then place it under your belt, where you wear the belt, and just lie down. So it doesn't matter whether the right hand is up or left hand is up. And then press the low back down on the floor. To do that, you have to draw the belly in. Feet can be straight, leg can be straight, or leg can be bent as well. If leg is bent, then it becomes a bit more intense. Ten seconds. 5 seconds. 3, 2. So minimum 30 seconds, but you can hold for 1 minute, maybe 2 minutes. It's actually a good compression to activate the muscle in this area. And if you see, this position is actually good too. It's a nice stretch for the shoulders as well. So for the pec minor muscle in the front of the shoulder that connect it with the first rib cage. Good. And then lie down, lie down on the floor, raise the hands up, and then just straighten them up. So all these I'm doing for the shoulder. As I said, median line passes through shoulders as well. So raise up really high and then come down. And when you're doing it, most important thing is use your scapula. Scapula should move up and scapula should move down. Scapula move up, scapula goes down. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Do it about 15 times. and exhale, relax. Another thing you can do for this syndrome is some massage. You know, this is thinner eminence. So what you can do is just press this, massage this upward toward the thumb. You want to massage in this area, you know, this where the skin color changes, where the palm start and dorsal part finish. The color become, in my case, brown to slightly whiter. So in this part you want to massage upward, and then inside of the thumb, so toward the dorsal side, massage a bit this one. So this is a full program I am giving you for anyone who have carpal tunnel syndrome. This is so common these days. Even if you don't have carpal tunnel syndrome, if any issue with the neck or wrist, then this will be helpful. So you're massaging the inner side. And then one last stretch is for this pec minor. Pec minor is also tighter in those people who have this carpal tunnel syndrome. And if pec minor is tight, so it starts pushing the nerve, so it reduces the space for the nerve to pass through. In some people, naturally this first rib cage is slightly elevated, and that even reduce the space further down for the median nerve. So actually I will tell you one stretch for that too, in case that is your issue. So pec minors, can you see this front of the shoulder where this, the rib cage, sorry, not rib cage, but this collarbone, you just connect with the shoulder with the acromion, and on the corner you have sort of triangle here, and you want to press this part. Good. Yeah, one more stretch, the last one for especially pec minor, and if you have an elevated rib cage. So you press the hands like this, clench your fingers together, open up the chest and open up the chest like you want to elevate it toward the roof. Yeah, you can come in this position. So take the shoulders back and open up the chest. So you want to stretch this part. Ideally hold for 30 seconds in this position. Keep breathing. Shoulder down and back. Seconds, 5 seconds, and relax. Nice. I hope this session will be helpful. If you have any other issues, please mention it. We'll try to make videos on all those issues. It's like a yoga clinic, so we'll try to introduce yoga movements and poses and other kriyas to help you overcoming various pains. The next video, I know many people have requested I have to make it on dharan. I made the video before and people liked it, so I'll make another one for dharan, how to address this issue of dharan in different people, because different people have different issues of dharan. Dharan is not just one monolithic kind of problem. Sometimes it goes up, sometimes it goes down, sometimes it turns sideways. We have different methods to treat this. So I'll come with soon with that video, and in the meantime, thank you very much for connecting. Please subscribe to the channel. It will help spreading the message of yoga and Ayurveda across the world, and I'm looking forward to see you soon. Namaste.